Interventional radiology, IR, is a specialized field within radiology that utilizes image guidance to perform minimally invasive procedures. These procedures encompass a wide range of diagnostic and therapeutic interventions, making IR an essential component of modern medicine. In this script, we will explore the various aspects of interventional radiology, from its definition and scope to the specific techniques and procedures involved. By the end, you will have a comprehensive understanding of the role and significance of interventional radiology in patient care. Let's dive into the world of IR. Interventional radiology can be defined as a subspecialty of radiology that employs real-time imaging techniques to guide minimally invasive procedures. It involves the use of various imaging modalities, such as fluoroscopy, ultrasound, CT, and MRI, to visualize and navigate within the body, providing precise guidance for treatment. The scope of interventional radiology is vast, covering both diagnostic and therapeutic procedures across multiple organ systems. Image guidance is the backbone of interventional radiology procedures. Fluoroscopy, a real-time X-ray imaging technique, allows for dynamic visualization of moving structures, making it invaluable for procedures like angiography and stent placement. Ultrasound, on the other hand, utilizes sound waves to generate cross-sectional images and is commonly used for procedures involving vascular access and biopsies. CT and MRI offer detailed anatomical imaging, aiding in accurate planning and guidance during complex interventions. Radiation safety is of paramount importance in interventional radiology. With the use of X-ray imaging, patients and medical personnel are exposed to ionizing radiation. As interventional radiologists, it is crucial to employ proper shielding measures, adhere to dose reduction techniques, and monitor radiation exposure. Additionally, adherence to strict protocols and guidelines ensures the optimal balance between diagnostic image quality and minimizing radiation risks. Vascular access is a fundamental component of many interventional procedures. Central venous catheterization, for instance, involves the placement of catheters into central veins, such as the subclavian or jugular veins, for various purposes like chemotherapy administration or hemodialysis. Techniques for vascular access may include ultrasound-guided placement, ensuring accurate and safe positioning of the catheter. Diagnostic angiography utilizes contrast agents and fluoroscopic guidance to visualize blood vessels and detect abnormalities. It plays a crucial role in the diagnosis and characterization of vascular conditions such as arterial stenosis, aneurysms, or venous thrombosis. Vascular imaging techniques, including computed tomography angiography, CTA, and magnetic resonance angiography, MRA, also provide detailed vascular visualization without invasive procedures. Percutaneous biopsy involves using image guidance to obtain tissue samples for pathological examination. This minimally invasive technique eliminates the need for open surgical procedures and allows for precise targeting of lesions. Similarly, percutaneous drainage procedures use image guidance to safely drain fluid collections, such as abscesses or pleural effusions, where catheters are placed under image guidance for efficient drainage and monitoring. Non-vascular interventions in interventional radiology cover a broad spectrum of procedures. Percutaneous nephrostomy involves the placement of a catheter through the skin into the kidney to drain urine in cases of obstruction. Biliary drainage, on the other hand, focuses on relieving obstructions in the bile ducts by inserting stents or drains to allow for proper bile flow. These procedures greatly improve patient outcomes and enhance their quality of life. Transcatheter arterial embolization is a valuable technique to control bleeding or deliver anti-cancer therapies directly to tumors. By accessing the arterial system, embolic agents, such as microspheres or coils, can be selectively placed in vessels supplying hemorrhaging organs or tumors, essentially stopping blood flow and causing tumor regression. This minimally invasive approach offers a less invasive alternative to traditional surgical interventions. Interventional radiology plays a significant role in the management of various cancers. Chemoembolization combines chemotherapy agents with embolic agents, delivering a potent treatment directly to tumor sites while minimizing systemic side effects. Radiofrequency ablation involves using thermal energy to destroy tumors, providing an excellent alternative for patients who are not surgical candidates. These procedures are transforming the landscape of cancer treatment. Endovascular interventions offer less invasive alternatives for the management of peripheral artery disease, PAD. Techniques such as angioplasty, stent placement, or atherectomy are employed to open stenotic vessels and restore blood flow, improving limb perfusion and alleviating symptoms. These interventions enable patients to avoid major surgeries such as bypass grafts. Varicose veins are a common venous disorder that can cause pain and discomfort. Interventional radiology offers minimally invasive treatments such as endovenous laser ablation or sclerotherapy to address this condition. These interventions involve closing off or eliminating the damaged veins, improving both cosmetic appearance and patient well-being. Interventional radiology has revolutionized the treatment of acute stroke caused by blocked blood vessels in the brain. Mechanical thrombectomy, a procedure performed under image guidance, involves the removal of blood clots using specialized devices. This highly time-sensitive intervention has significantly improved patient outcomes and reduced long-term disabilities associated with stroke. Interventional radiology has become an indispensable field within medicine, providing minimally invasive alternatives to traditional surgical interventions. Its broad scope covers diagnostic and therapeutic procedures across various organ systems, empowering healthcare professionals to deliver precise and effective patient care. With its continual advancements and innovative techniques, interventional radiology continues to shape the future of medical practice, enhancing patient outcomes and improving quality of life.